Hello, I want to thank you for tuning into today's discussion about the role of primary care in the coordination of multiple specialties for rare and complex conditions. My name is Shannon Bennett. I'm a rare disease parent and advocate. Most of what I've learned has been through trial and error, and I strive to share these findings with other rare families to maybe spare them some of the challenges that my own family has faced. Care coordination is sometimes one of those challenges. I found that it's really helpful for rare conditions because multiple specialties are often involved. And in the beginning of the journey, primary care typically initiates specialty referrals, but then the scheduling and coordination is kind of up to the family and specialty office to figure out from there. Some primary care practices help with scheduling and coordination more than others, but oftentimes I find there's a little bit of a gap in coordination and assistance. I definitely felt like this was worth talking about this year. So today I'm joined by Dr. Drew Stransky of Rockford Pediatrics, who is going to share with us sort of the role of primary care in working with rare and complex conditions and the coordination of care that's needed for these cases. I want to thank you, Dr. Stransky, for sitting down with me today to have this conversation about the role of primary care, because I feel like it may be really helpful for families like mine who have been affected by rare disease. But before we get started, it might be helpful for you to just introduce yourself and tell our viewers a little bit about your background, practice, and experience.
Well, thank you for having me. So I'm Drew Stransky. I graduated undergraduate from the University of Michigan. And then my medical school was out in Arizona, and I did my training at DeVos Children's Hospital in Grand Rapids, Michigan here. And I'm a primary pediatrician, so I don't specialize. And we all have our interests and so forth, but there's no other specialties other than just general pediatrics itself.
Okay.
I've been in practice, I should mention, I've been in practice about 18 years now. I've practiced in Wisconsin, North Carolina, and also Michigan. So.
Okay, thank you. When we talk about rare disease, our inclination is to think that it's not very common, right? But as we've mentioned during Rare Disease Day events in years past, we've found that if we lump all of the rare conditions together, rare disease doesn't seem quite as rare anymore. Would you say that your practice sees a fair number of patients with rare diagnoses?
Yeah, I would tell you it's kind of a mixed situation here. So I always say, like in life, we see common things common. So it is correct that if you take all the children that have rare diseases and you combine them, that obviously the number is going to be higher. So for example, we're a 2 pediatrician practice, and we may see 2,500 patients, let's say, in our practice total. Well, of that, if you combined all the real rare diseases, we might see 20, maybe at a most 50 children that have those. But we see a lot more of the common diseases like asthma and allergies and eczema and things like that are much more prevalent. But yes, in terms of rare diseases, we see more of them when we combine them together. However, you also have to take that each disease is so different. And so it's a different compilation of symptoms or a different compilation of like a specialist that it requires essentially. So even though we see more of it, I would say that each case is independent and separate. So
sure.
Yeah.
And I know you can't speak for all primary care practices, only your own pediatric practice, but sure. What do you see as your role as the primary care provider, particularly for families affected by rare disease?
Yeah, I think, the role of primary care, whether you're talking about pediatrics or family practice in general, is we are kind of the gatekeeper for these kids. So, we're here to make sure that we're taking care of all the basic things that the child's needs, like with a regular child that doesn't have this rare condition, we want to make sure that their immunizations are up to date, that they're growing properly, that they're getting their wellness exams, that they're getting taken care of if they're sick, routine things. But then our other job is also to be the gatekeeper for these kids to make sure that they're getting the coordinated care that they need. And so you can relate to this when we come in with your daughter. We're always talking about, are all your needs met? Are we getting, the therapy we need? With some patients, it's speech therapy or occupational therapy or physical therapy. Sometimes we need referrals to multiple specialists like neurology and pulmonology and cardiology, or it depends on what the case is. But that's our job, is to help to coordinate that, to make sure that we are kind of the liaison between the specialists, because it's not in medicine, oftentimes they don't all communicate with each other. So by us taking on that role can help the families to bring it all together, basically.
Absolutely. And another thing worth mentioning too is when you have a kid with a complex diagnosis like Kenzie, who has a lot of different issues going on, sometimes pediatric care is the place to start. So if she's extremely fussy and we feel that something's happening, a lot of times we start with your office to check her ears, check her throat, check all these things that, because she's nonverbal, she's not able to say my ear hurts or my throat hurts. So primary care is a lot of times where we start too. And then we try to start with the least complicated thing it could be and move toward the more complicated things, which in Kenzie's case, it's usually more complicated. But
and it goes back to that initial statement we said, or that I said, that common things being common. So the most likely scenario is if you have a child that has a cold, maybe it's an ear infection or a pneumonia or something or just a cold, versus immediately jumping to it's some kind of aspect of the disease process itself, which sometimes it's not. So
for sure. And I know for myself and probably a lot of other moms and dads out there, or caregivers out there, it's not always easy to think in terms of maybe it's not, the ceiling about to come down with something super scary and complex. So it's kind of nice to have that primary care provider that can say, look, it's just an ear infection or, something simple. So there's that too. Now, you kind of touched on this a little bit already, but how does your office handle the referral and coordination process with kids that have rare and complex conditions who require many different specialists? And what types of support can your office or a pediatric primary office offer to these families as their primary provider or their, like you said, gatekeeper?
Yeah, so most of the insurance companies will require that we get a specialist referral through the primary care provider. So, we make sure that it's an appropriate referral and one that's going to be beneficial to the family. And then we look at whatever the syndrome is or whatever the disease is or the condition. And we say, okay, in this case, we need this specialist and this specialist. And then we get that referral process going. So we have nurses that fill out forms that need to be submitted in order for that process to take place. And then our office at least follows up to make sure that those referrals are going through and then make sure that the families have gone to those appointments. So we kind of connect the dots between it to make sure that that's all getting done. Other than that, I think, the only other thing we can do is be a resource to families in terms of like certain conditions, there's support groups and so forth that families can get in touch with. Because these are rare, sometimes that's challenging, some of these rare conditions. So, if there is a network, I had a family that was in with a rare condition a while back, and the mom was looking for some support. And I said, just go under Facebook and do a search for this condition and see what comes up. And oftentimes you'd be surprised. There's a group, there will be a group on there, a bunch of families that have kids that have this condition. And it really can be helpful to know that you're not the only one going through this. So we try to guide them in that aspect too.
That's definitely helpful. I know that Helen Voss Children's Hospital has a program called Care Partners that helps with care coordination. We're actually part of that program, and they have a really neat space that families can use. But unfortunately, due to such a great need, they have quite an extensive waiting list. Aside from that particular program, are there any other resources or supports for families with this need that you're aware of?
Not that I'm aware of. It's usually most of the big hospital centers have that network, but we're seeing this more and more. COVID has not helped this any. And because of that, things got shut down or put on the back burner. And so, we're finding that a lot of these referrals and a lot of these appointments are getting pushed back as well. So the appointment times sometimes are 6 to 12 months out, which is really a struggle. So we, as primary care physicians kind of struggle with that as well, but it's limited in terms of what we can do with that.
Sure.
Yeah.
Well, we hope that at some point that will expand and change.
Yeah.
How do you approach a patient with what you suspect to be a potentially rare syndrome or diagnosis, but one that doesn't have a diagnosis yet?
Yeah, so a lot of it just boils down to experience, and so, as primary pediatricians, we just see hundreds of kids a week. And so over
Sure.
time, you get to know what's normal and what's not normal. So if you start seeing red flags, that's when you start looking into things. So for example, sometimes we talk about phenotypic, which means like facial features or where you look at a child and say something's just off. That may be an indication that that there's something else going on. Maybe it's a kid who's failing to grow or isn't developing properly. That's a red flag. So that's where those well child exams are so important, because we go over that with, in primary care. We look at the growth curves. We look at the developmental milestones. We make sure that they're reaching what they're supposed to do. And then sometimes we go from there, and it may be getting lab work, or it may be imaging, or it may be referrals to get the proper diagnosis. Sometimes we send kids to genetics to help set this up. So it just depends. It's hard because there's so many different conditions that require different elements of care, but that's kind of what we're looking for. There's things that are out of the ordinary, and that's where those wellness exams are so important when it comes to this.
Sure. Okay. Now, rare disease research, is constantly evolving and changing in time. How would you say advances in research and technology have affected your practice as a primary care provider?
Yeah, so this is a difficult one too, because there's diversity within these diseases.
Sure.
And so, and we're talking about a spectrum of specialties that this involves as well. But I will say, as a generalized topic, that research and technology has been an enormous help, obviously, with these conditions. So the more we learn about these conditions, and there are more technology or pharmaceuticals that are out there to help, it can really dramatically improve the prognosis of the child. So, I'll give a couple examples of some diseases that may not be in the extreme rare category, but things that people have heard of. Like, so for example, cystic fibrosis. That's an example where that disease used to get diagnosed later in life. We had to wait until those kids had problems to diagnosis. Whereas now, it's part of our newborn screen. And it's been that way for years. So it's picked up on the newborn screen. We get those kids to the specialist right away if they're positive. And then it can make a dramatic improvement instead of waiting for things to go bad, so to speak.
Yeah.
That's an example. Another one would be like cancer treatment. That has been incredible changes in that in the 18 years that I've been in practice. The prognosis for kids with leukemia, the success rate is now 95%. I mean, years ago, 30 years ago, it may have been 50% of those kids had a 5-year survival rating. So that's where the research, the technology can help those families, and to help the actual disease course or the prognosis too.
Sure. Okay. As you may remember, we switched to your practice when Kenzie was about 3 years old. And the reason we switched was multifaceted, but the biggest factor was practice size. So
Yeah.
I was looking for a smaller practice, and I'll tell you why.
Yeah.
Our first primary care practice had numerous providers in the same office, which was great when our son Kyler was our only kid, and he was super uncomplicated. And, it just meant that they had great availability, and we could always see somebody. And, so that was great. But I found that when we were in crisis with Kenzie and her specific pediatrician was unavailable, getting advice from a physician who didn't know her complicated history was really tricky. And honestly, a lot of times it left us feeling even more isolated than we already did.
Mm-hmm.
But switching providers was also quite scary, because I didn't know what to look for. I didn't know what to expect.
Mm-hmm.
And I don't know if you remember this, but I actually scheduled a time to meet with you and ask some questions before we made the big switch.
Sure.
I asked questions about the after hours process, your comfort level and experience with working with a child who had as many complexities as Kenzie did at that time. And she has even more now, 3 years later. But I found that initial conversation to be quite reassuring, and it gave me the courage I needed to make the switch. It was the right move for us because when we need advice, I know that you and Dr. Alt are the only two physicians in the office, and you both have gotten to know Kenzie quite well.
Yeah.
And that just means that you can guide me quickly and effectively when something happens. I find this relationship between family and physician office really important, especially when dealing with kids that have complex conditions and rare ones at that. So for a family looking for a new primary care provider, or maybe their first primary care provider with a child that has a rare diagnosis, what sorts of things would you encourage parents to look for or ask about before making that switch?
Yeah, so I think you hit on some really good points. And I'm not sure if it's a smaller office makes it easier because you only have to know two of us, of course. But I wouldn't let that be the only determining factor. I think it really depends on how the family, or excuse me, how the practice runs. So, Dr. Alt and I really go out of our way to try to make sure we have continuity of care. So you see me for your kids for their physicals. You don't bounce back and forth and so forth. But the reality of it is too, we're all individuals and we take vacation or we have a day off or that sort of thing. So you're going to have to see other people occasionally. And that's where the small office sometimes can be beneficial because you only have to know the two of us and we know, Kenzie really well. And so it makes it easy because you're absolutely right. The frustration of having to call and explain your daughter to a new provider every time can be a struggle. So really looking at the office that you're interested in and how they approach that. Is it something where when you schedule a physical, you might get with 7 different providers and you don't know who you're going to see? Are you going to be able to see that provider each time? How far or how long does that, or how much does that provider work? Are they full-time? Are they part-time? And that can be a big issue too, because in pediatrics, there's a lot of part-time providers. And so if that provider is only in the office 2 days a week, well, we know that, kids just don't get sick on certain days or have questions on certain days. Also looking at that provider's experience and comfort in taking care of complex kids. I'll be the first one to admit when it comes to these rare conditions, oftentimes I have to educate myself on it as well because they're rare. That's the reason they're called that. And I bank on the families a lot too. You guys are the experts in it, I'll be honest. Like you guys know more about this condition and the disease process oftentimes than us primary care docs do. But then we know how to get you to the places that you need to go to. And so I think those are kind of the basics of it. What happens after hours when you have a crisis or a complication? Can you reach out to that office? Who are you going to talk to? Even asking, another thought would be asking that your primary doctor talk to their staff and their partners in a pediatric office meeting to say, hey, let me introduce you to this patient, Kenzie, and I'm going to tell you about her so that if mom or dad calls, you're aware of who she is. Sometimes that can go a long ways too.
Yeah, that's a great idea. My last question is, what advice or encouragement could you give to a family that's still searching for answers or that's maybe just feeling isolated or on an island by themselves with this rare diagnosis?
So, one of my favorite sayings in life, and I may have told you this in the office, but control the controllable, because in life, honestly, that's all we can do. So when it comes to this, it's overwhelming. And so a lot of things go through a parent's mind, right? You think about short-term effects, you think about long-term effects. What is this going to mean for me? What is this going to mean for my family? And the problem is you're not going to have those answers right away. So I think as a parent or a provider, the way I look at it is in my own life, whether I'm taking care of kids or whether I'm taking care of my own kids, am I doing all I can in using every resource available to help either my child or that child be the most successful in life? And I think that's the approach you need to take. So, if your child is struggling with a condition that has speech issues, let's get that child into speech therapy. If we have, muscle spasticity or problems with walking or structure or so forth, let's get that child into physical therapy. Are we doing the things that we need to do to give them the best chance at having a successful life? Are educational wise, are we doing everything? Are we getting them to the specialists that they need? Those are all examples of things that we can control and that can have a big benefit. But the worries about all the other things that I mentioned aren't going to help. It's not going to help the child, and it's not going to help the parent. And so if we can kind of focus on those things that are beneficial and the most important, I think it goes a long ways in terms of the care of that rare, complex child.
That's great advice. Well, I want to thank you, Dr. Stransky. I appreciate your time sitting down and having this discussion with me to share with our rare disease community.
No problem. I appreciate you asking me.